So we're now looking at statements that are made for the purpose of medical diagnosis or treatment. This is Federal Rule of Evidence 803-4. And what you're going to find from this rule is that it's fairly broad, as we'll see in the McKenna versus St. Joseph's Hospital case. So in this case, McKenna, who's now deceased, had a schizophrenic disorder, and as part of the hospital's knowledge of this disorder, we want to show, or his estate wants to show, that he was seen driving erratically in his car, getting out of his car, and walking through traffic. Now, the fact that he did this shows that there's some sort of psychiatric disorder that he has. People don't just tend to walk through traffic. But how do we get that statement in? How do we offer for the truth of the matter asserted that he was in fact doing that? And the answer, you'll find there are a couple of different ways that we could use these statements against the hospital. One would be we could offer them for the truth of the matter asserted under 803-4, and that's what we'll talk about first because that's what this rule is all about. So who saw this? These were just bystanders, and we don't even have any idea who these people are. So it's very important to recognize that under these hearsay exceptions, we don't actually have to know who makes the statements so long as they fit within the hearsay exceptions that themselves are designed to create reliability. The theory behind statements that are offered for medical treatment or diagnosis is that the person making the statement would be honest with a doctor. So notice how broad this then becomes. This statement does not come from a patient, and it doesn't directly go to a doctor. It's the folks who have immediately responded to the scene of the accident. And so, and you would regard those people, to be doctor-like. So it's not that crazy that we're offering it to them, but it wouldn't have to be someone who had a medical background, as it was in this case, people who are part of the emergency rescue team. It could be to someone who's transporting this person to the hospital, whether or not it was an ambulance. If someone just said, "I'll take him there," if you say, "Tell the doctors this is what I saw," that would be a statement offered to try to assist with someone's medical diagnosis or treatment. It doesn't have to be your own. If you're trying to get help for somebody else medically, then that fits within the meaning of 803-4. So these bystanders, whose identity we never learn, say to the emergency personnel, "We saw this guy have a crash or drive erratically and then get out of his car and walk around traffic, walk around in traffic." So again, we don't know who they are. Their statements aren't about medical things. They're about behavior. So this wouldn't have to be about something like, "I saw him get hit with something." This is describing his behavior. The statements are then made to people who then transport McKenna to the hospital, and then that rescue team relays the statement to the hospital. Now, the rescue team didn't actually see what happened. The rescue team didn't see him drive erratically or walk around through traffic. They are relaying something about which they don't have personal knowledge. Does that still qualify under 803-4? Yes, because it's made for the purpose of medical treatment or diagnosis. That in that case, this rule is interpreted broadly enough that we believe that when people are trying to assist someone in treating a patient, that those people relaying that information will be honest and will not concoct something. That's our big concern about most of hearsay. We're far more concerned about lying than we are incorrect information. So I said there's another way this information could have gotten in. If we're offering the statement of the rescue personnel to show the hospital's liability, we could have also offered it not for the truth of the matter asserted. We could have offered it the statement of the rescue folks to show that the hospital had notice of the condition and offer it as non-hearsay, saying we aren't offering it to show that these things happen, but rather that the hospital had knowledge of these things that occurred, that he was driving erratically and was walking in traffic, so that we can show the hospital was aware or should have been aware of a potential psychiatric condition. But we're not looking at non-hearsay in this segment. We're looking at statements made for the purpose of medical diagnosis or treatment. And so both the statements of bystanders whom we never see again to medical personnel or rescue squad folks, that statement is for the purpose of medical diagnosis or treatment. And then that next level, when those rescue personnel go to the hospital and relay what they heard from the unknown bystanders, that is also for the intent of helping the guy they're delivering. And so that's also for the purpose of medical treatment or diagnosis. And so that fits quite squarely within 803.4's exception.